Welcome to the Origins of Psychopathology and Criminal Behavior Risk Factors, also Forensic Psychology. All right, let's get started. Our objectives for this video presentation is to identify social, family, and psychological developmental risk factors that lead to delinquency and crime, to demonstrate how early childhood experiences can lead to antisocial behavior, and to emphasize influence of peer rejection on child behavior, and stress connection between cognitive abilities and delinquency and crime. The developmental pathway. Each person follows a different developmental pathway, the characteristics of which can often be identified at a very young age. The development perspective views the life course of all humans as following a pathway or a trajectory, might you say, that may be littered with all different types of risk factors. So some of those risk factors can be described as experiences that are common factors in the background of offenders, such as school failure or abuse of alcohol or childhood victimization. In studies of both adult and juvenile offenders, researchers are beginning to identify a number of different pathways. And some children follow a pathway leading to serious delinquency and crime, while others follow a pathway that may lead to minor juvenile offending, and for others, there's no offending at all. So every person follows a different developmental pathway. So those risk factors can be different and have different risk factors and have a different pathway is what we're saying. So it gets kind of tricky sometimes. Now let's look at antisocial behavior. And do you see that little green asterisk? Well, whenever you see a green asterisk, sometimes that's me kind of cueing you that that's something that you're going to see on a quiz. And also, don't be scared because I will do a review for the quizzes. So these are just kind of extra reminders. All right, so an example case. Let's see if you can answer this. Because remember, these video lectures are in addition to your reading. So I'm expecting that you have done the reading before you go over these lectures so that these are reinforcing your readings. Okay, so Walter starts pushing other children in the 4th grade while waiting in the lunchroom. Then Walter goes into the 8th grade and he starts smoking marijuana. Then when Walter's in the 10th grade, he's suspended from high school because he either hit another student or became aggressive or violent. And then when Walter was 18 years old, he was convicted of robbery. Walter's blank behavior, including his criminal behavior, can be traced back to his childhood. So what type of behavior is that that's in that blank where the red question mark is? Antisocial, and hopefully at the very top gave you a clue. All right, good job. That's kind of giving you a clue of how antisocial behavior kind of started from a young age. All right, risk factors most concerned with individual attributes and developmental, social, and family experiences believed to increase probability that an individual will engage in persistent criminal behavior. An example of social risk factors are poverty and impoverished resources, antisocial peers, peer rejection, and preschool or school experiences. Parental and family risk factors include faulty or inadequate parenting, sibling influences, and child mistreatment or abuse. Example of psychological risk factors are inadequate cognitive and language ability and troublesome temperament, inadequate self-regulation skills, and poor interpersonal and social skills. It is important that we learn about these risk factors and how they influence the developmental pathway, especially during the stages of development. Early identification will help improve the effectiveness of the prevention and intervention programs. And we also must be really careful during this period to remember not to imply that all criminal behavior has its origins in childhood. So these are just examples. They are not set standards that we can say, hey, this is going to happen in all cases. They're just examples of what can happen. However, pathway researchers emphasize that some individuals begin their criminal offending in adulthood, not childhood, and this may or may not be precipitated by childhood experiences. Example, some researchers have documented a pathway consisting of adult onset female offenders whose criminal careers began when they engaged in dysfunctional relationships with male offenders. Nonetheless, again, risk factors are present in the childhood of both juvenile and adult offenders. All right, so relationship between poverty and violence. It is not well understood, for example, poverty is often accompanied not only by inequities in resources, but also by discrimination, racism, family disruption, unsafe living conditions, joblessness, social isolation, and limited social support systems. Youth living under poverty conditions are more likely to attend inadequate schools, to drop out of school, to be unemployed, to carry a firearm, to be victimized, and to be a witness to a variety of violent events. Therefore, many factors other than one's economic situation come into play. So, one of the weakest predictors of later involvement in antisocial behavior is early rejection by peers. True or false? What do you think? Choose one. False. One of the strongest predictors of later involvement in antisocial behavior is early rejection by peers. Peers are really important. All right, so poverty influences parents' behaviors towards children. The stress caused by poverty in urban settings is believed to diminish parents' capacity for supportive and consistent parenting, so which leads to coercive and highly aggressive methods of child control. Which children are prone to peer rejection? There are three important differences between peer-rejected boys and non-rejected boys. First, peer-rejected aggressive boys are more impulsive and have problems sustaining attention and staying on task. Consequently, they're more likely to be disruptive of ongoing activities in the classroom. Second, peer-rejected aggressive boys are aroused to anger and more readily and probably have more difficulty calming down. This emotional rage is more likely to result in physical and verbal attacks on peers. And third, rejected aggressive youngsters have fewer social and interpersonal skills for making friends and maintaining positive relationships with peers. Gender differences in peer rejection. Most research has focused on boys. Amongst girls, little is known about the combined efforts of aggression and peer rejection. The development of antisocial and delinquent behavior in girls can be predicted by early involvement in aggressive behavior with peers. There is also some evidence to suggest that relationally aggressive girls are more likely than non-aggressive girls to be peer rejected. Preschool experiences. The percentage of mothers with children under age 6 working outside the home has increased. For example, in 1947, only 12% of mothers worked. In 1975, it went up, 31% of mothers worked. In 1997, 64% of mothers worked. And in 2003, more than half of mothers with infants, less than one, were in the workforce. Wow, what a change. After-school care. Quality of after-school care has been closely associated with the development of antisocial behavior. In the 1990s, the term latchkey children was applied to children who returned home to an empty house. Children who spend fairly large amounts of time unsupervised or in after-school self-care programs with other peers with minimal adult supervision. The school failure was also linked to antisocial development and delinquency. 4 types of parental styles, and we see that little green asterisk again. The Diana Barmond identified 4 parental styles. 1, authoritarian, which is to shape and control a child's life. 2 is the permissive, no control and extremely few restrictions. 3 is authoritative, to be rational and apply reasonable restrictions. And 4, neglecting, detached and unengaged in a child's life. All right, we have the Snyder and Patterson 2 parental styles to contribute directly or indirectly to delinquency. So we have the enmeshed style, where parents see an unusually large number of minor behaviors as problematic and they use ineffective authoritarian strategies to deal with them. These parents don't ignore even very trivial excessive behaviors. And then we have the lax style that employs strategies that are not sufficiently attuned to what constitutes problematic or antisocial behavior in children. Consequently, they allow much of the behavior to slip by without disciplinary action. Then we have parental psychopathology. Children of parents, especially mothers who are clinically depressed, are at increased risk for a range of socio-emotional and behavioral problems, including antisocial behavior, emotional dysregulation, and poor cognitive development. As children grow older, they continue to display behavioral problems and engage in various kinds of criminal behavior. Then we have Bowlby's attachment theory. Early relationship between infant and caregiver largely determines quality of social relationships later in life. According to Ainsworth, infants with avoidant attachment style have parents who are aloof, distant, and prefer to avoid intimacy with their children. Consequently, these children, as adults, have difficulty forming intimate relationship. Infants with anxious ambivalent attachments usually have parents who are overbearing and inconsistent in their affection and intimacy. Developmental risk factors for delinquency. So here's a list of social risk factors, which I'll let you pause and look over. This list is also in the chapter provided for you on Moodle. Psychological risk factors. Lack of empathy. Empathy is perceived as existing along 2 dimensions, affective and cognitive, and one cannot possess both affective and cognitive empathy. Intelligence and delinquency. What is the meaning of IQ? It's so misunderstood because IQ is not identical to intelligence. IQ is an abbreviation of intelligence quotient, derived from a numerical score on an intelligence test, or what is now called the psychometric approach. The term psychometric intelligence has not caught on, so IQ is still utilized. Children with high scores on tests of intelligence tend to learn more of what is taught in school than their lower scoring peers. Schools help develop certain intellectual skills and attitudes. IQ and ethnicity. IQ scores do not vary among racial and ethnic groups. For example, many studies using different tests and samples typically show African Americans scoring significantly lower than whites. Asian Americans and whites on average score about the same. Native Americans score slightly lower than other groups on verbal scales, but this slight difference may be the result of chronic middle ear infections common among Native American children. Latinos, who make up the second largest and fastest growing minority group in the U.S., typically score somewhere between African Americans and whites. It's unclear what these reported differences mean, but there is no evidence to support the view that racial or ethnic difference in psychometric intelligence are due to genetics or biological factors. All right, this starts us now into part 2, forensic psychology. Our objectives are cases that we're going to look at in reference to insanity and the competency to stand trial, Andrea Yates and Jeffrey Dahmer, and then we're going to look at forensic psychologists and psychiatrists as profilers and the need for critical thinking, independent thinking, and ethical practice. So what is the difference between a psychiatrist and a psychologist? So a psychiatrist is a physician. They're a medical doctor who's gone through medical school, who specializes in psychiatry, who can diagnose illnesses, both psychological, medical, and prescribe medication. Psychologists are doctoral level clinicians. They've studied psychologists and have various levels of training and conduct research. Insanity and competency to stand trial. So, an inability to stand trial is often equated with insanity. Is that the case? No. Competency to stand trial relates to a defendant's current ability to understand his or her legal predicament, charges, possible outcomes, and to assist an attorney with his or her defenses. There are different standards in different jurisdictions, but generally a person needs to be able at the time of the crime to understand what he or she was doing was wrong or against the law. The Andrea Yates case. She was a nurse and a mother of 5 children, ranging in age from 6 months to 7 years old. I've put a link here of a video I recommend watching, and this is also in your book to read, so make sure you know and understand this case. This case is well known. I remember this case coming out. I was an officer when this came out. She was suffering from depression, postpartum depression. She was being treated by a psychiatrist. She was under antipsychotic medication and antidepressants. In 1999, she did attempt suicide. In 2001, her dad passed away, and her depressive state got worse. 2 days before the killings, a psychiatrist lowered her antidepressant medication but kept her off the antipsychotic medication. And after her husband went to work, she methodically drowned all 5 of her children. She said the mark of the devil was hidden under her hair, and she thought the cartoons her kids watched were sending them messages. Pretty sad. All right. During her trial, Dr. Dietz, a psychiatrist, testified. He was the only forensic psychiatrist who testified for the prosecution. He examined Yates on November 6th and 7th. He said Yates suffered from a major mental disorder, schizophrenia, but disagreed that she met the criteria in Texas for the insanity defense. He divided the crime into 3 phases: the pre-homicide phase, the homicides, and the post-homicides. And he also testified at trial that Yates saw an episode of Law & Order on TV in which a woman drowned her children and was found guilty by reason of insanity on the TV. And the fact that she watched the TV and then did it said that she was competent to stand trial. After she was found guilty, they found out that there was no such show that had ever aired. Yates was convicted of capital murder in the deaths of 3 of the 5 children and sentenced to life in prison. An appeal was filed on January 6, 2005, and the Texas First Court of Appeals overturned her conviction. After retrial in 2006, she was found not guilty by reason of insanity for the deaths of 3 of her children, Noah, John, and Mary. And now she's in a mental hospital. All right, Jeffrey Dahmer, and here's a little clip you can watch on him as well and what happened. And this is also in the chapter that we linked in Moodle. In July 22nd, 1991, a man came out. He was frantic. Police stopped him. He said he just had a really uncomfortable experience at a man's apartment. Police went to the apartment. It was the apartment of Jeffrey Dahmer, and they found pictures of bodies, and they found body parts, including heads. The investigation revealed a 13-year killing spree and 17 victims that were killed between 1978 and 1991. His MO was to invite homosexual men or boys to his apartment. He would drug them. They were then incapacitated, and he would strangle them. And he reported having sex with some of the bodies and sometimes eating the body parts. At trial, Dahmer did not have a major diagnosable mental illness in spite of the bizarre nature of his crimes. He initially entered a plea of not guilty by reason of insanity, but changed his plea to guilty, but insane. In February, got my dates wrong there, 1992, the court rejected his insanity plea, and he was sentenced to 15 consecutive life sentences. And then on November of 1994, another inmate at Columbia Correctional Center murdered him, so he is no longer with us. All right, so need for critical thinking. So critical thinking skills are extremely important so that every aspect of a case is questioned. The profiler must not simply just review reports, they must critically review all the data. They must ensure the results or inferences are reasonable and supported by the evidence, and one cannot assume the facts of the case. One should be willing to question the supplied facts and evidence as necessary. There also must be independent thinking and analysis. The profiler or psychiatrist, psychologist should work together but independently of the agency. The independent thinking must occur, and the person who is hired must never be pressured into finding what the client wants them to find, period. And that's hard to do for a lot of profilers because there's just so much pressure. And a tragic example of this was in the Branch Davidian standoff in Waco, Texas. If you don't know about this, I highly recommend you watching the documentary on it or at least reading about it. The FBI profiler was pressured to change his assessment of how David Koresh would respond to the various siege attacks. The profiler recommended negotiating with Koresh. The supervisors favored tactical pressure on the compound after being advised that his memos cautioning against an aggressive approach were tying their hands. He wrote another memo supporting a more aggressive strategy. The result was a huge loss of life. We also have the ethics of it all. It's a huge consideration in the profiling world of forensic psychiatry and the psychological practice. Practitioners in these fields need to take reasonable care that others do not misuse their work product and do not materially misrepresent their expertise. The profiler needs to understand that his or her profile cannot and should not be used to indicate the guilt of a particular individual. And fitting a profile is not the same as an identification. For example, the standard is no different from the standard of a criminalist who offers an opinion that two hairs are in a match. It doesn't mean the person is a DNA match. It just means they're a match. All right, this ends this video presentation. Thank you.